If the word hantavirus sounds scary or alarming, look, you're not alone. Honestly, yes, it's a rare virus, but it's a serious one that can cause life-threatening illness. We're going to talk about how it spreads, what to watch out for, the symptoms, all of that stuff so that you understand what's going on here. Guys, I'm Dr. Jen Caudle. It is good to see you. Thanks for watching this video. Okay, so let's first jump right in and talk about what is hantavirus. Now, hantavirus is actually a group of viruses that are found around the world. They belong to a family called Hantaviridae, and they're carried by certain species of rodents, mainly mice and rats. Now, there are two main types of illnesses that hantavirus can cause, and this is important. So in the Americas, like including the United States, it causes something called hantavirus pulmonary syndrome, or HPS, which primarily attacks the lungs. Now in Europe and Asia, it causes hemorrhagic fever with renal syndrome, or HFRS, which mainly affects the kidneys. Now, both forms are caused by the virus damaging the lining of tiny blood vessels, which leads to fluid leaking into the lungs or the kidneys, and this is one of the things that makes it so dangerous. So how do people contract hantavirus? I know you're wondering. The most common way is by breathing in tiny particles from the urine, droppings, or saliva of infected rodents. Now, this can happen in a number of situations. I'll give you some examples, like if you sweep or clean areas where rodents have been living, like in a shed, a cabin, or a barn. If you disturb rodent nests or droppings, sending the particles into the air. If you handle materials contaminated with rodent waste, as an example. Now in the United States, the deer mouse is the primary carrier of the Cinnobre virus, a type of hantavirus, the most common cause of hantavirus pulmonary syndrome. Now it's important to know that you generally cannot catch hantavirus from other people. The one exception is the Andes virus found in South America, which has been linked to person-to-person spread through close or prolonged contact with an infected individual. You also cannot get hantavirus from dogs or cats or other domestic animals. It is specifically carried by wild rodents. So now let's talk about symptoms, because I know you're wondering about this. Now, hantavirus symptoms typically appear 1 to 5 weeks after exposure to the virus. The illness usually progresses in two phases. Now, phase 1 is the prodromal phase. This is the early stage, and symptoms honestly look a lot like the flu. They include things like fever and chills, or severe muscle aches, especially in the thighs, the hips, the back, headache, fatigue. There's also potentially nausea, vomiting, diarrhea, or abdominal pain. Now this phase lasts about 4 to 10 days. Now phase 2 is the cardiopulmonary phase, and this is where things can really progress and become very serious very quickly. This includes things like cough and shortness of breath that can worsen, like get really bad really fast. Also can include a feeling of tightness in the chest, can include rapid heart rate, dangerously low blood pressure. And this is happening because fluid floods into the lungs. People can really go from feeling like they have the flu to needing a breathing machine within just hours. It can be very, very severe. And this is why early medical attention, honestly, is so important with this virus. Unfortunately, there is no current specific antiviral medication or vaccine that's been approved to treat or prevent hantavirus. This is one of the things that makes it so tough. Treatment is entirely supportive. That means that medical professionals, we doctors, etc., work to keep the body functioning while it's fighting off the virus. And that can include things like supplemental oxygen, mechanical ventilation for people with a pulmonary form of hantavirus. There are other treatments that can be used to try to help the body. For people with sort of the kidney disease part, we're monitoring kidney function. Dialysis might even be implored. Look, I'm not going to lie. This condition is very severe, and it can be very severe. Well, because the illness can deteriorate so rapidly, anybody suspected of having this really should be transferred to a hospital with an intensive care unit, really honestly, as quickly as possible, okay? That's just the bottom line. Now, if you're wondering what the outlook is, like the prognosis, well, the outlook and the prognosis really depends on how quickly it's recognized and treated. It just depends. It also depends on the type of hantavirus infection the person has, whether it's the pulmonary type, the kidney type, how soon it was found, what treatments they received, how quickly they received medical treatments. I would also say the person's underlying condition probably matters a lot as well. The good news here is that hantavirus is rare It is preventable. You want to make sure that you're keeping rodents out of your home. You want to store food in sealed containers. You want to really be careful when cleaning areas with signs of rodent activity. There are ways to do this that you can find with the CDC, etc. You want to avoid disturbing rodent nests. That type of stuff is very important. And then, of course, if you develop any symptoms that are unusual, flu-like symptoms after potential rodent exposure, you want to seek medical attention, and you need to tell the healthcare providers about this particular exposure with rodents. So hantavirus is rare, but it is serious, and that's where awareness and you understanding about this really comes into play. If this video was helpful, please let me know in the comments. Share this with someone else. Please like and follow my page on Facebook. Please subscribe to my channel on YouTube. I'm Dr. Jen Caudle. Please keep it locked here. I do daily videos on different medical topics. I hope this was helpful.